Welcome to part 3 of 4 in the series Resiliency. This presentation is prepared by Dr. Karen Semmons, a faculty member from the College of Nursing and Professional Disciplines at the University of North Dakota. This presentation focuses on self-resiliency. The objectives for this presentation are to identify ways to assess self-resiliency and ways to improve and build self-resiliency. Resiliency is the ability to bounce back from adversity. Each person is going to react differently to adverse events in their lives, such as trauma or grief. The reference for this slide has 8 different scales on how to measure and assess self-resiliency. We are only going to mention 2 of them. The first is the Brief Resilience Scale, which has 6 short questions. 3 are worded negatively, and the same 3 questions are worded positively. Depending on how it is scored on a 5-item, Likert scale, ranging from strongly disagree to strongly agree, will determine the person's resiliency score from low resilience to high resilience. The link to the questionnaire is attached for your convenience. The second scale is the Connor-Davidson Resilience Scale. It also measures how well a person is equipped to bounce back from adverse events. It was originally developed to assess those with post-traumatic stress disorder. However, it can be used in other situations. It measures several different components of resilience: the ability to adapt to change, the ability to deal with what comes along, the ability to cope with stress, the ability to stay focused and think clearly, the ability to not get discouraged in the face of failure, and the ability to handle unpleasant feelings such as anger, pain, or sadness. There are different versions of this scale, a 2-item version and a 10 or 25-item version. The 2-item version asks, I am able to adapt when changes occur, and I tend to bounce back after illness, injury, or other hardships. The 10-question version takes 10 questions from the 25-item version and includes the questions from the 2-item version. The link to the scale is attached. According to the American Psychological Association, or the APA, resilience is the process and outcome of successfully adapting to difficult or challenging life experiences, especially through mental, emotional, and behavioral flexibility and adjustment to external and internal demands. The APA identifies that there are factors that contribute to building personal resilience: the way one views and engages with the world, the availability and quality of a person's social resources, and the person's specific coping strategies. Another source, Psych Central, identifies 10 ways to build resilience. Number 1. Make connections by having good relationships with family and friends. Number 2. Avoid seeing crisis as insurmountable problems, realizing that we can't change that stressful events will happen. However, what can change is how those stressful events are interpreted and the response to the events. Being able to look beyond the present and try to see how the future will look. Number 3. Accept that change is a part of living and that certain goals we once had may no longer be able to be reached, and accept that things can't be changed. Number 4 is to move toward your goals by making realistic goals and acknowledge that you are moving towards those goals even if it is a small step. Number 5, take decisive action by acting on the adverse situations as much as possible and don't detach yourself from the problem and wish it would go away. Continuing with the 10 ways to build resiliency. Number 6, look for opportunities for self-discovery. Often we learn something from the struggles and may grow in some respect. Sometimes relationships become stronger, we may develop more spiritually and have a greater appreciation for life. Number 7. Nurturing a more positive view of yourself will help build confidence in the ability to solve problems. Number 8. Keep things in perspective, look at the situation in a broader text, and try to avoid blowing the situation out of proportion. Number 9 is maintaining a hopeful outlook. Being optimistic will allow you to think of good things that will happen in your life. And lastly, number 10, which is very important, take care of yourself. Pay attention to your needs, try to exercise, and eat right. An appropriate quote for this topic comes from Gever Tully. He states, "Persistence and resilience only come from having been given the chance to work through difficult problems." These are the references used for this presentation. Thank you.